The COVID-19 pandemic is a healthcare crisis for those hit by the virus, but also for those who no longer have healthcare coverage because of the economy. In this Eye on Health report, Latrice Curry explains what that could mean for local health clinics.
Local medical facilities in our community, like the DEO Clinic, have always been there to help those who need it most by providing free and often life-saving health care. And now, with record unemployment, they expect to see even more people walk through their doors.
As people lose their insurance, we do anticipate an uptick in the need for our services. And, it's going to be tough down here.
The DEO Clinic has been providing health care to people in Whitfield and Murray Counties without insurance or who lack financial resources for nearly 15 years.
Probably 80% of our patients have a chronic health care condition. It might be, COPD, diabetes, hypertension, or heart disease.
And for anyone who has those chronic conditions, access to medical care is critical. So for those who now find themselves without insurance, they still need treatment. They're not only at greater risk for developing complications from the coronavirus, but also other life-threatening emergencies.
Without the DEO Clinic, maybe be going to the emergency room to have basic care for the chronic health conditions.
Going forward in this new environment of COVID-19, patients at the clinic can expect to see changes.
Well, going forward, we've been taking precautions and, screening everybody that comes in the clinic, be they volunteer, be they staff or patient.
So that every patient who comes to the DEO Clinic can be given a mask to take with them and use, for protection while they're around in the community.
Those at the DEO Clinic say healthy patients make for a much healthier and stronger community.
When we provide health care, it benefits, an individual as well as their family, but it also makes for a better community.
That was Latrice Curry with that report. And sticking with our Eye on Health coverage, we've seen strange symptoms show up in some COVID-19 patients. Now we're learning of dangerous complications in children as well as damaging heart problems in adults. Doctors in Washington found 1 in 3 COVID-19 patients were left with heart damage. They say even patients without pre-existing medical conditions could end up with heart failure.
Sometimes it's not just the virus involved that directly infects the heart, but the body's immune response to the virus that overreacts and your immune system starts attacking the heart. And that's common with certain viruses.
And a growing number of children are suffering from an inflammatory syndrome that damages organs. It is rare, but in one case, a 12-year-old suffered cardiac arrest.